How are you doing today?
Doing well. How are you?
I'm doing okay. I'm doing okay. Well, first, let me do the obligatory introductions. I am here today with Dr. John Rothwell. Gosh, now I can't say your name. FNP. I was so focused on getting the letters right that I forgot your last name. That's terrible.
That's okay. I love you anyways. Yep.
It
So
can't be
John
perfect.
Rothwell. Yep. John Rothwell, Doctor of Nursing Practice, Family Nurse Practitioner. Thank you.
Yes.
Thanks for having me.
Yes, thank you for being here always. So we're going to keep it kind of short today because I don't feel good today, but I'm here anyway because today I'm going to exploit you just a tiny bit and get advice. But it's advice that I think a lot of people will benefit from. So I think I have a kidney stone. I think. I am not a doctor, although I do play one in the movies. But so I did this, about a month or so ago. I did this, went through this whole song and dance, and I posted on Facebook getting advice from my friends, which, by the way, I have some really smart friends, just for the record. I have really smart friends, and I got a lot of good advice. I got some interesting advice. Some of that advice got me really drunk one night, right?
Yeah.
Jay Patel, if he's listening out there, he told me, see, I have fun friends too, so that advice is not too bad. He was like, you need to drink beer, which I don't drink beer anyway, because I don't like beer. You know why I don't like beer? Take a wild guess why I don't like beer.
Makes you pee.
No, it makes me burp. That's so unladylike. Who wants to do that? It's
Depends
terrible.
on your lady.
No, it's terrible. So, but I went to Florida Beer Company. I'm gonna give a little plug for Florida Beer because I love local businesses, and Florida Beer is one of my favorite, even though I don't drink beer. They have an amazing cider that's a rosé, so it's almost like a sparkling wine.
Mhm.
So I went and bought a 6-pack of that, and I said, okay, I can do this. And I sat on my balcony and I proceeded to embark on a journey to drink all 6 of them, and failed. I think I got 3. I got 3 and I was quite tipsy, and then I put the other 3 in the fridge and went to bed. But I did pass a stone the next day. So what's your verdict on that? Was it the rosé or was it coincidence? Come on.
So the kidney stones have to travel. Usually we call them kidney stones because they build up from different types of particles, and there's multiple types of kidney stones. We can talk about specific types at another time, but there's a handful of different types that start in your kidneys. Your kidneys kind of sit protected back behind your rib cage, okay? And they have to travel from there all the way down and out, right? And so they have to move from one space to the other, and hopefully they don't get stuck. So was it the rosé? Was it the fact that, is it, you drink beer and beer makes you pee more, therefore, it's filtering out more? Old wives' tale, more likely than not. But staying hydrated is key. If you're dehydrated, then you increase risk of more buildup, if you will, and you're not going to provide enough flow for that stone to pass through. And everything that we have, including those little tubules and the ureters and the urethra, it all has smooth muscle. So those muscles have to flex, just like flexing. And so in order to get that stone to pass through, so that takes plenty of fluid and plenty of motion to go. Unfortunately, we are in so much pain. Typically, we don't want to eat or drink anything because of the nausea and the pain, and we don't want to move because it hurts. And those are the 2 worst things that we can actually do. So,
well, my pain is not real bad most of the time. Like, it comes and goes. It does hurt, but usually really just only for a few minutes, and then it goes away. But the nausea is not exciting. I don't like that. That's been happening for about 2 days now. So that was my next question, actually. Is that kind of a symptom that is common that falls in with kidney stones is nausea?
Sure,
Stomach.
nausea does. I mean, some people get more nauseous with pain and just kind of that wave comes over you. You know, you kind
Yep.
of have this sharp stabbing, thing going on, and you just get this wave of nausea because um, when you have pain, your body responds with the fight or flight response, which actually starts with these little glands that sit on top of the kidneys called adrenal glands. And so you have this surge of adrenaline and then this downward spiral too. So the crash, so to speak.
So, okay, so that brings me to another thing that's been happening. I'm just curious if it's all associated with what you just explained. So I do not have a fever. I don't have a fever. I've tested my fever. I don't. But every once in a while, like right now, for example, I just get this like little wave, like it's not really a cold sweat, but it kind of sort of is, like just for a second, like it feels like I have a
We don't want to
fever.
ask you your birthday though.
Stop that. I will turn this off right now. That's it. I'm done. I never want to see you again.
Well, you can't and you
What
have
the
to.
heck?
And here's the
That has
reason why.
nothing to do with anything.
That has nothing to do with any, that's right, because
But
it's
no,
interesting.
does it? Seriously.
When I work with my female clients, and I love my female patients, one is because they're not afraid. Most of them aren't afraid to make themselves vulnerable and share emotion. And guys, they want to be macho. No matter, we basically talk about size when we're able to recognize size as a difference, and then we grow old and we're still talking about size. And I don't even need to tell you guys about what. But when it comes to women, tend to be, to share their emotions and talk about these things. And so we hear this, and this gets off the kidney topic, but this is reality. Just because we're aging doesn't mean we should feel this way. Sure, whether it's perimenopause, menopause, postmenopause, etc., doesn't give us an excuse to feel bad. And I think a lot of times we go to our primary care providers, or in women's case, primary care, if they're comfortable. If they're not comfortable, they go to the GYN, and they don't address it because, like, oh, it's just part of getting older. I call
I
bullshit.
hate that. I hate
You know.
that so much. I had a doctor tell me one time, well, you're getting a little older. This could just be your new normal. And I could just choke him. I could choke him right now. And that was years ago, way
Yeah.
sooner than he needed to be saying that anyway.
Exactly.
But
Exactly. So that, but from a provider perspective, that makes situations like this challenging. So when
right.
we talk about, the increase of epinephrine, the adrenaline that goes into your body, absolutely, you'll have a wave of heat. And why? Because your muscles in your body need to warm up before they get started and do anything. It's why we pre-stretch and these kind of things before we exercise. And now there's a lot of research in the way we do that too. Now you want to warm up the muscles before you stretch the muscles, before you exercise the muscles. So, so that's dynamic stretching and those kind of things. So we want to, we don't want to assume just because you're X age doesn't mean that, I have this heat wave or hot flash or whatever you want to describe it as that's just normal because you're getting that age. And again, for lack of better term, bull pucky.
Thank you for clarifying that, because you were about to be in trouble.
No, I wasn't. I know how to talk to the
Okay.
ladies.
Okay. Yeah, no, I don't. I really, in all seriousness, I don't think it is associated with that. I think it is associated with whatever's going on, because it happens. Generally, I get like a wave of nausea and then that little cold sweat, and it goes away and it's okay. But I'm not running a fever. But I guess really when it comes to, as much as it pains me to admit this, when it comes to kidney stones and feeling like this, I really should seek medical attention and advice.
Well, it's so the question is, what do you do? And I always like to ask myself, what are we going to do? And if we do something, is it going to change the plan of care? This is the kind of non-traditional insurance way of, or insurance way of doing things. Like if you go to the emergency room and you think you have a kidney stone and you have a physical exam, and then they do a CT scan, and that costs money, and that's radiation, and et cetera, et cetera. And while there are times when that's absolutely appropriate, there's something called hydronephrosis, where for the lack of, in common terms, the stone gets stuck. Right. And then you have backflow, right? And it causes that kidney to, causes some kidney damage, maybe even cause a kidney infection, or vice versa, depending on whatever order. And in those terms, you want to know that the kidney's actually stuck, it's not moving, you know where it's at, and you know how big it is, and do you need to refer to nephrology to possibly have some help getting the kidney stone removed. And so 7 millimeters is kind of like that magic mark where we say, oh, that's too big to kind of pass. And if it's smaller than that, we depend on how much we, kind of give you a hard time. If it's 2 or 3 millimeters, like with the male, we're just like, dude, really? But women can typically tolerate a lot more than men. And so, 5 or 6 millimeters, they're still cussing their doctor and cussing the kidney stone, but we're able to pass those safely. You just want to make sure that they don't get stuck and cause further damage. And so we keep an eye on that, right? I know this, if you're sitting here talking to me, then that's not the case.
Right. I'm getting really bad feedback for some reason. You know what? I bet it is my hair hitting that microphone. That's what it is. See? That's why I should pull my hair up. Anyway. Okay. Yeah. Like I said, my pain is not too bad, but I have a really, really high pain tolerance. So there's that. So with that being said, what would be the symptom that would make you want someone like me to reach out to you and say, hey, maybe we should check this out a little bit deeper?
Well, one, because you have access to me, I want to know everything, right? Hey, John, I'm feeling this and this and this. Just thought I'd let you know. And I would be more inclined to say, okay, well, increase your fluid intake. When I say increase your fluid, you want to drink half your weight in ounces of water a day. And so there's also some natural remedies to do, like have warm lemon water in the morning and those kind of things.
I had somebody tell me that.
Yeah.
One of my friends did tell me.
So I like that.
So.
That helps with kidney stones and urinary tract infections and that kind of thing.
Mm-hmm.
And then obviously just watch for blood, right? And then watch for blood in the urine, and watch for worsening or increased pain. And so you and I have been talking about this little joker for the past couple of weeks, and so we know where it started at was back in the back, and then now it's kind of changed positions and moving, and so we know it's kind of moving its way out, which again says, okay, well, more likely than not, it's a kidney stone, because it's moving, and it's moving along the same track that your anatomy moves. And so we know that it's probably going to get a little worse before it gets better. So we want to, increase our fluids and hydrate. And, and then there's some traditional approaches to care that the literature on it is, not super significant, where you can give medications that help relax the smooth muscle along the ureters, and that say it may or may not help. With women, sometimes they want to give antibiotics because they're afraid it's going to end up in an infection. And with a guy like me, I'm always considering antibiotic resistance and superbugs, and so I try not to do the antibiotic thing unless a patient who you're in control of your body. So if it's safe, it will have the discussion. If I don't think it's safe, I'm just not going to do it.
Right. Yeah, which I'm not a big fan of jumping on antibiotics unless it's necessary. So.
But, from a supplementation perspective, to make sure that you have the right nutrients in your body, and, you know me, I'm a big anti-inflammatory diet guy. So I like my protein and my vegetables, my root vegetables, my green vegetables, and my fruit. More people, make kind of in no preservatives, kind of like a paleo type of diet is what I like. But anti-inflammatory, and then make sure you have plenty of B vitamins, B12, B6, B2, B1. So a complex vitamin B would be good. Zinc, here's another time where zinc is good for you, and then vitamin C. And so we hear this quite a bit. Whether, now we're talking kidney stones, but, over the past few months, we've been talking viruses and increasing our immunity system. And then there's a few other things that, are, kind of help with people who are more common to have kidney stones, it's not in your normal diet, but definitely helpful.
And there are a lot of people who have chronic kidney stones. I appear to be one of them. So yeah, so I am going to make an appointment to come and get your analysis, kind of check it out, because I do think it's progressed to that point.
Sure.
So I'm going to do that, and I don't feel great, so we're going to call this a wrap. But before we do, I have to tell you that I really like the new setup in your office, and I like the new background. And I know you don't know this, or well, maybe you do, because if you've been looking, there are people who are walking by, and so it makes me think of the what is the show where they're in New York and there are all the people that walk past the window and they come up and they put a sign up in the window. Totally, you're going to have somebody come up behind you and put a sign in the window. And
Well, maybe a couple of the ladies that just joined the Island Direct Primary Care tribe. So,
yeah,
hopefully you'll get a chance to meet Nola or Maddie in the next few days. Nola's working a couple days a week, and
nice.
Maddie's working 1 day a week. So
yeah, we got to get them to video bomb you.
Yeah,
Come
right.
up behind you, and yeah, that'd be great.
Maybe Maddie's all about the social media, and Nola is, you're not going to put me on social media, are you? And so and I go, well, I can guarantee one thing: I'll make you somewhat uncomfortable. And so I think there's a healthiness to being a little bit uncomfortable. That comes with our vulnerabilities, right? And so I think it challenges us to, and helps us grow. So.
Well, you just send her to me. She doesn't have to be uncomfortable. You tell her we just get to chat and do fun things. Before we go, let me just look real quick and see if anybody has asked any questions. And then we're going to go, and I'm going to take a nap. Don't tell anybody. Oh, there we go. Nobody has asked any questions today. What in the world? I guess I need to do a better job of telling people that we're going to be here and what we're going to talk about. Because we did have some good questions there for a few of the, but we're not going to talk about the COVID thing today. So just
COVID, yeah. COVID and now influenza.
Oh, boring kidney stones. What were you saying? I'm sorry.
And now influenza, right? We've had a bunch of, not in my private practice, but we've had a bunch of influenza A in the urgent care centers. So continue boosting your immunity with, diet and supplements. Again, this is one of those things where, we talk social distancing with COVID, but to be honest with you, during influenza season, respect your neighbor's space. And if you have fever and cough, cold, flu symptoms, keep your butt at home.
Right. That's like the easiest thing. All right, I'm signing off. Have a nap calling.
You're awesome.
You are too.
Take care.
Thank you. Stop. Bye, everybody.